The virus that we're talking about having to do, a lot of people think that goes away in April with the heat, as the heat comes in. Typically that will go away in April. We're in great shape though.
Unbeknownst to all of our idiot scientists working on vaccines and drugs that might help us, our president had us covered. The heat will take care of everything. Hello everybody and welcome back to the MedBros channel, and we have to talk about what the hell is going on with coronavirus, because unfortunately it will not just go away and is actually seeming to get a lot worse. So you guys can check out the previous video on this channel that covers coronavirus, or just watch the countless amount of footage out there that covers the same topic. In this video we are going to talk about this. A live tracking map that looks like the tracking of the next Smash Brothers game. People getting body bagged alive. People held on cruise ships for a week and then gathering them up, herding them onto a plane, and making the entire quarantine useless when you mix the infected with the non-infected. People making money off of masks and disinfectants, fights breaking out amongst panicked people, conspiracy theories, and full-on panic headlines. If there was a tracking software for the flu like there is for coronavirus, people would be going to the stores and not only emptying out the masks, but they would be emptying out the toilet papers for all their soiled underwears after they would see those statistics. There's talks of closing down our borders, and there's literally so much news that's just erupting with coronavirus. So let's try to tease through all this hubbub and get down to the really nitty-gritty details about what matters. The big news going around right now is the rapid spread of coronavirus, which is now on every single continent except Antarctica. At least the penguins will survive this. The CDC has made it clear that they think the United States is about to be hit really hard. But why this is a big deal is probably not what you have in mind. Let's look at this. So as of right now, there's up to 80,000 people infected, and we're getting up to 3,000 deaths, with about 24,000 people that have actually recovered from the disease. These numbers are very optimistic, and I guarantee you there are far more infected out there. One of the things I wanted to do is put these numbers in perspective. So we have these coronavirus numbers, but I want to compare them to influenza, something we are very familiar with. Influenza this season alone has caused nearly 26 million infected with 14,000 deaths. So as you can see, quite a difference. COVID-19 definitely needs to be taken seriously, with a mortality rate of around 2.3%, while our flu here in America is around 0.1% mortality rate, which means you die from the disease. Now, why I think these numbers are being thrown around a little haphazardly is, like I said, we don't really know the amount of infected people. The true number is probably much higher. That means the mortality rate, I suspect, is probably going to be lower than 2%. I'm sure there are unreported deaths as well, but not as many people that are going to be infected and not reporting it and being asymptomatic and recovering. There's going to be quite a discrepancy, bringing that mortality rate down. Regardless, I think most doctors and scientists think that the mortality rate of COVID-19 is higher than influenza. Also, it's suspected that COVID-19 is a little more transmissible than influenza, which means you can spread it a little easier. So the R0 number for influenza is 1.3, and it's suspected that the R0 number for coronavirus is somewhere around 2.2. So with coronavirus, an infected individual can pass it on to around 2 people, versus influenza is going to tend to pass it on to 1 person. I also wanted to compare the severity of patients with influenza versus coronavirus. About 1% of individuals with influenza will develop severe symptoms and need to be hospitalized, while 13.8% of COVID patients were severe and 4.7% were critical. It is important to note that a lot of these individuals with the more severe symptoms of coronavirus were older, they had comorbidities, they had something else going on that made them more susceptible to get super sick. And like all numbers, you have to take everything with a grain of salt. COVID is a new virus and doctors just don't know how to treat it. We haven't seen this in modern medicine, this specific virus, and we don't have any drugs for it. We don't have any vaccines. We're a little more comfortable managing patients with influenza. We have drugs like Tamiflu. We have a vaccine. We know what the complications are for influenza. We're more comfortable with it overall, which is going to affect that mortality rate, bringing influenza's mortality rate a little lower. It is important to note that there are some drugs currently being tested for COVID-19. Remdesivir is one of the medications being tested and hopefully will show some significant results. So I bring up this comparison to influenza to really show that it's not this doomsday virus that's knocking everybody out, but at the same time, I do want to urge people that it is time to start being a little more alert about what's going on and be a little more prepared for what's to come. Currently, there are many infectious disease specialists out there that think that coronavirus is about to be integrated as a common community virus that's going to be around for a while. Like having a flu season, we might have a COVID-19 season, or just have COVID-19 just beat this virus we have to worry about all the time. So as doctors every year, we're going to have to keep our eyes out for this virus that likes to sneak its way into the lungs, sit there really quietly and replicate, be able to be passed on to other individuals and be contagious during this time period, and then hit you with a pretty possibly severe infectious respiratory illness. Some of these individuals with more severe symptoms could develop acute respiratory distress syndrome, like I mentioned, which is very serious respiratory illness that requires ICU level management. The way our ICUs work will probably have to be restructured. There's going to be a massive influx of patients, we're thinking, with coronavirus that are going to need that level of management. It's going to be a hassle logistically to just deal with this amount of patients. Hopefully that vaccine does come out soon, but at the same time, you're going to have to get everybody on board with this vaccine to develop that herd immunity that is so important for vaccines to work. And that's not going to be hard to do, especially in 2020. Ooh, I can't believe I have to say that with the anti-vaxxer movement. So going forward, we will see how intense things get in the United States. This is not the end of the world, but I do suggest at this point people do a couple of things. If you're running around trying to get these masks, make sure you're getting an N95 mask. Those little surgical masks are not going to do anything for you. So make sure when you're buying a mask, N95. Simple stuff of stop touching your face, wash your hands, and avoid super public places like airports or unnecessary outings that you don't need to go to with a bunch of different people that are possibly even international individuals that are all coming together in a place like Times Square or something like that. If you don't need to be there, don't be there. And stock up on basic stuff like water and non-perishable foods. This is stuff that you probably already should have been doing. This is not like doomsday stuff that you should be scared into getting. I feel like people should have a stockpile of water, food. Maybe that's just because I live in California and I'm paranoid about earthquakes. I already have this supply kit. And along those lines, if you have a flu-like syndrome, if you're having malaise, you're feeling tired, you're sweaty, you have a fever, that doesn't mean you have coronavirus. There's no reason to rush to the ED if you're just feeling a little down for a couple days. I'm not discouraging anybody that feels like they need to go to the ED to not go to the ED. Of course, if you have an emergency, go there. But I'm just saying there's no rush just because you have these mild symptoms to rush into a place that is full of sick people where everybody is going to go. If somebody does have coronavirus, that's where they're going to be, is in the emergency department. You don't want to rush into a place that's just covered in sick people. That's going to get you sick. You might get something that's completely unrelated to coronavirus. So if you have these symptoms, it might be best to just have some supportive care at home, fluids, some Gatorade, some rest. I mean, that's what you're going to be getting at the hospital. We don't have any magical drug that's going to make you feel better. The hospital really is for those individuals that have those severe symptoms. They can't breathe, they're having chest pain, they're coughing up blood, really bad stuff. So the TLDR of COVID-19 right now is this shit is spreading like wildfire. You're going to be seeing this all over the news for 24/7 coverage, and it's going to be going full-blown panic mode. Everybody's going to be just spreading the news, misinformation left and right. Just be prepared for that. And with it spreading through all these countries, inevitably the United States is next. I do predict there's going to be a rapid increase in the amount of coronavirus cases in the United States. But wait, that does not mean to panic and everything's going to go to hell. Just relax. Coronavirus, like I mentioned, with those mortality numbers that I just showed you, if you're a healthy individual, you're taking care of yourself, you're kind of avoiding excessive being in places that you don't need to be, you will be fine. You don't need to panic or worry or stockpile thousands of dollars of supplies. All I'm saying is just be safe, use common sense, and we're going to be okay. The absolute truth is that this upcoming year is going to be full of COVID news and COVID updates. So strap in and get ready for the ride. Make sure you guys subscribe to the MedBros channel. We'll keep you updated with the real facts and not this panic mode bullcrap you're going to hear from everybody. So if you want that, make sure you subscribe. There's a bunch of other videos on this channel as well, and we will see you guys in the next one.